So first I'd like to introduce, I've got some people here with me today. So firstly, my name's Jackie. I'm the Director of Studies for the Bachelor of Nursing, so Curriculum and Student Matters. So that means that I look after all undergraduate nursing students in the program. I'm also a nursing researcher, and my area of research is around violence against nurses and more broadly healthcare workers. Amanda can't be with us today. Unfortunately, she's unwell, but she's our Deputy Head of School Teaching and Learning. Judy, did you want to just introduce yourself?
Hi, my name is Judy Smith. I'm the first and further year Student Experience Coordinator. Big mouthful, but that basically means that I'm here to help transition students into the university life and also working with academics to help facilitate that smooth transition so that you can get the most out of university. I'm a lecturer in nursing, and my research interests are simulation and also looking at how technology impacts the way that we work as nurses and the implications to nursing responsibilities and also to patient care. So very interesting topic.
Thanks, Judy. Mark.
Oh, hi everyone. My name is Mark Goodhue. I'm the Academic Liaison Officer in the Faculty of Health. So basically I support students who may have a mental health condition, a disability, or a physical health problem. And also I support people who are carers or who may be pregnant as well, to support them with their studies as well. I'm also a lecturer. My mainly teach in mental health and drug and alcohol nursing. And my research involves working with marginalised populations and doing co-production research as well.
Thanks, Mark. And we also have Rose with us this morning.
Good morning, everyone. I'm Rose Calera. I'm Manager of the Clinical Administration Unit, and I will be my unit will be looking after all your clinical placements, all your administration, all your compliance that you'll need to do. So you'll have a lot of involvement with our unit and the team. So welcome.
Great. Thanks, everybody. Okay, so first a little bit about us. The School of Nursing and Midwifery at UTS was established formally back in 2020, so pretty new. Prior to that, we were part of the Faculty of Health, and we've been part of that and a prominent part of the Faculty of Health for decades before that. As a school, School of Nursing and Midwifery, we're committed to improving the health and well-being of individuals and communities through our world-class research, global connections, and inspirational evidence-based teaching. At the moment, we're actually ranked #1 in Australia for nursing and number 11 in the world, which is something that we're all very, very proud about. We're privileged and lucky to have staff that include a lot of high-profile award-winning educators and researchers. We also have experienced clinicians who are still practicing clinically. We collaborate a lot with industry partners, and we work hard as an interdisciplinary team to help develop world-class approaches to healthcare, education and research. And as a result, our graduates are actually very highly regarded and have a well-earned reputation as outstanding clinicians, leaders, change agents and innovative researchers. At the moment, we have more than 3,000 students enrolled in our undergraduate and postgraduate nursing and midwifery courses across the university. So today's session is also going to be your opportunity to ask us questions. So if you have any questions, you can type that into the chat, into the Q&A, and we will at the end have that opportunity to answer those. If we have a lot of questions, you might receive your answer in a text reply from one of the panelists or from the Faculty of Health Marketing team who are there to help us moderate the questions. So being an online event, you know what can happen, so please bear with us. If we have any technical issues, we'll work quietly and quickly behind the scenes to try to resolve those. If you find that at any point you can't access the webinar, the advice is just to log out and to log back in again, and usually that resolves any issues. But a reminder, we are recording this, so worst case scenario, you could come back and access that recording. So students who complete the Bachelor of Nursing degree at UTS, once you have completed the degree, you will become a registered nurse. And so a registered nurse is registered through APRA, and once you join us at UTS, you will be registered as student nurses. You can see that there are nearly 300,000 registered nurses in Australia at the moment, and we are very much in demand. I would add in there as well in vaccination centres at the moment as well. So as I said, we're ranked #1 in Australia, something we're really proud of, and this is, I think it's the second, it could be actually, I think it's maybe the 3rd or 4th year that we've been ranked #1. So it's something we've been able to consistently hold on to. And what do we do? Nurses do a lot of things, but really what is at the core of our business, I guess you would call it, is that we provide person-centred care that is evidence-based, and we work in a variety of healthcare settings, and we can become experts in a range of specialties as well. So we would really like you to come and study nursing at UTS. We think we've got a lot to offer. If you were able to be on campus today, you would see that we have amazing state-of-the-art nursing clinical facilities and simulation labs. And you'll be engaging in those from your very first session of study. And it really gets you, you'll have the uniform on, and the aim is to get you to feel like a nurse from day one of your studies with us. Most of our academics are still working, also work in industry, conducting research as well, and we've fed that into the curriculum. We did start a new curriculum this year, and the feedback we had from our accrediting body was that it was actually of world-class quality. So it was very, very high feedback we received. So here's some logistics about the Bachelor of Nursing, including, the previous ATAR ranks. It will take you 3 years if you complete full-time. And if you are an EN and you meet the criteria, so namely that you've been qualified in the last 5 years and you're registered, you would get through that in 2 years. And you can see there that there are a couple of dual degrees as well, and that would take you a little bit longer. So what's involved? So lots of different ways that we engage with you, and I guess the traditional ones of we have labs and tutorials. So tutorials in the theory subjects, clinical labs in our clinical subjects, and you'll be doing a mix of those each session. We also have simulation labs that you'll be engaged in. Lectures, a lot of that is in the online space, but we also have face-to-face. And then when you're in your tutorials and in your labs, you'll be working collaboratively, because as nurses, we work as part of groups all the time, so as part of multidisciplinary teams. So you'll be interacting and collaborating with your classmates. But as well, it's academic work, so there's a lot of independent time for independent study as well, and academic reading. So your clinical placements start early in the degree, and we'll look a bit more about what that looks like. But from your first year, you'll be going out on a clinical placement. And our first year students that are currently enrolled are getting ready for their first placement in October. Lots of global opportunities as well that you can become involved in. And when campus, so 2022, let's be positive, and everyone will be back on campus. We've got lots of different clubs, including nursing specific ones that you're welcome to engage in, and also the more traditional university clubs, I guess, around sport and extracurricular stuff. We've got a range of assessments, so we've got a real variety that are spread across the program so that you're not doing the same things all the time. So while there might be essays and case studies, they're just one of the things that we do. So we aim to have a lot of practical assessments, because the degree is very obviously going to become registered nurses. That's something that's practical. So we aim to integrate that in. And we also take advantage of clinical placements to assess you there as well. So what does the program look like? So you can see here, and we've kind of got this spaced out in terms of the clinical placements that you'll be doing. So each session you would be doing 4 subjects, typically a clinical placement or more each session. In first year, that starts in spring session. So at UTS we have autumn and we have spring session rather than first and second semester. So your first clinical placement is 3 weeks. In second year, you have a mix of placements. So you'll do, we have clinical practice subjects each session. You do a placement in those of 2 weeks, and also specialised placements here. So you do one in aged care and one in mental health as well. And the aim is to increase the number of hours as you go through the program, because you increase your ability to be able to provide nursing care. By the end of the degree, our aim is to have you managing a patient load, obviously under the direction of a registered nurse, so that you're really ready to step in as a new graduate nurse. And you can see there that your final placement in spring session will be a 6-week placement. So the bulk of the hours are sitting there in third year. UTS is pretty unique because we have specialist subjects that you can enroll in your final year, and this gives you a taste of what specialty you might like to move into, and there's a list there that you can see. So Judy would tell you, oh, you should do perioperative nursing because that's her specialty, whereas Mark would tell you probably to do drug and alcohol nursing, that's his specialty, but he's also a mental health clinician. I would say critical care, because I've worked in the EDs, but lots of different opportunities there for you to enrol in your final year. We have a range of clinical placements, so you'll go to a lot of different areas, and Rose is the expert on this and can answer questions around this, but we're affiliated with over 100 clinical settings with an agreement with every local health district in Sydney, which is great. It means we can place our students widely across the Sydney area. Rose's clinical practice unit allocates nursing placements for students. The aim is to have that within an hour's commute from your home. Placements occur in 2 to 6 week blocks, as we saw there. You're only going to go during the week, and you will either do an AM or a PM shift. So we don't do overnight shifts. You might be pleased about that. You also do have the option to go on rural and remote placements, and you can see there some of the examples, including the air ambulance, which is a pretty cool placement to be able to do. So we've mentioned before the facilities that we get to use, and you can see just a little snapshot of them there, but we have high fidelity clinical simulation suites that we use. We have 16 clinical practice labs, and the aim there is to mimic real hospital settings. And you've got a little snapshot there, but they really are quite amazing, and they're located in level 6 of our building. We also provide patient care and empathy scenarios with what we would call simulated patients or actors, just so that you have that practice speaking to a real life person. And so again, you can see all of the settings that we use here. And we need to do this because not all learning is going to happen in labs or tutorials. We do need you to develop non-technical skills. So something like communication, you do a whole subject on it because it's really critical and at the core of what we do as nurses. And it remains one of the areas that we strive for improvement because it is linked to errors in healthcare. And to poor patient experience as well. So communication, teamwork, all really vital. And so we get you to engage in different settings to hone those skills. So where are we? You probably have seen our building. If you've been in the city, you would have seen it. We've got a massive campus. It's quite unique because it's across Sydney. You can see the tower building. That is our original building. That's the one with the UTS logo, the tall one there. So we really are in the heart of the city. We're really near, close to public transport, a quick walk from Central Station. And we're all in building 10. And our labs are in building 6, and we're all located on, level 6, we're all on level 7. And that amazing picture that you can see there with all the glass is the UTS Central building, which is pretty new to us, and that's where our library is. And it's just quite an amazing building. Lots of amazing resources for you to access there. So at the end of the degree, what should you look like? What are we aiming for in our registered nurses? So we want you to be able to have knowledge and skills so around, and these are kind of the cornerstones, I guess. So person-centered care. So what that means is you're looking after the person, not so much the patient. So for example, the patient in bed 6 with the appendectomy, you're looking after, you know, Mr. Smith, and it's a more holistic way of looking at patient care. You're entering a profession that really really values the professionalism of nursing. We think it's, you know, the most amazing profession that there is, and so it's important to have a professional disposition. Mentioned before already, communication and collaboration, they're key to successful patient care. Everything that we do must be based on evidence-based practice, and we go to the evidence, and that is what guides our care, and that's what ensures that we provide safe care to our patients. Indigenous cultural respect is central to what we do and is woven through our studies, as well as having a standalone elective study. We want you to be critical thinkers, so we want you to be able to care for your patients, to think about what's happening to them, and to be able to direct the care, to be able to raise questions with, you know, other clinicians, with doctors, to provide the best care, to be able to advocate for your patients. And so above all, we need you to be professionally competent, so that you're going to be an effective part of the healthcare team. And I think you've seen at the moment in the current situation how vital nurses are in the healthcare system. So there is the opportunity, so you can go so many, in so many directions with nursing, and everyone on the panel here, it's taken us in lots of different ways. And you might start off in acute care, end up in education, you might move into management. And what we've got on here is really just a smattering of the areas that you can end up in. Some of these things you might want to do further study, and certainly in nursing, what we would say is that we have a commitment to lifelong learning, and that's part of being a registered nurse. We have to provide evidence of that professional development each year. And some of these specialties you might want to go on and do postgrad studies with us as well. So these kind of feed into the different careers. So you will start off as a registered nurse when you complete with us, and you'll become a new graduate nurse. That's typically a nurse in their first year. And these are all of the different things that you can become. Specialists, you might decide to become an educator on the ward or work in education more broadly. You know, the person in charge of each ward in a hospital or each nursing home is actually a nurse. And so a lot of nurses work in management. Nurse practitioners are, you know, super specialised nurses who have prescribing rights in Australia. So they're real specialists. They work in areas, for example, like wound care. We have them in emergency departments as well as other areas. So UTS has lots of different resources that can help you to succeed, and it's really important to take advantage of all of these. For example, we have the Student Centre. So this is where you can drop in and submit any requests online for advice around student matters, maybe around your timetable and things. We also have HELPS, which is a great acronym. So these are the people who are sitting there waiting to help you around your writing, your academic assignment skills, that academic part of your studies. Timetable planner, one of the things that we know that students struggle with, and also new graduate nurses, is planning their activities. So we have a timetable planner. UTS Online is just at the moment we have moved, everything is on Canvas. So some of you may already be familiar with that. And it's just that's the repository, that's where you interact with your subjects, and all the resources are there. As I said, we have an amazing library. Even though our students can't visit it at the moment, its online presence is massive, lots of support available for students and lots of resources there. We have an amazing careers service who work closely with nursing, especially for students in their final year, to help us with events around careers, to help us practice interview skills for those new grad jobs that you'll be going for in that final year. So they're a really great resource to students. And we also have something unique. We have what we call a practice lab. And so this is a lab that's dedicated for our students. We share that with midwifery as well. And students can book into that and go and practice some skills. So for example, if they had a placement coming up and they wanted to practice skills around subcut injections, for example, they could book some time. The resources are there, and we also have a dedicated staff member in there to assist with that. So we think that's a really quite a great facility to have, to be able to offer. So how do you apply? So you're applying through UAC. The dates on here, non-recent school leavers, there's competitive entry. So it's all around going through the UAC system to do this. So applicants over 20 years of age at the time of applying can also opt to sit a special tertiary admission test, but obviously lots of detailed information about the admission criteria can be found on our website, and you can see the link to it there. So now what we'd like to do is throw to you so that you can ask us any questions. Like I said before, you might just receive an answer in a text reply from one of the panelists or from the Faculty of Health marketing team who are here. They have done all the hard work behind the scenes to help us come to you today. So let's have a look at, I might just start reading questions. Okay, so I'm just going to start reading out questions and asking those. So, hi Hayley. Hayley's just asked, do you have any accelerated programs for people who hold non-nursing bachelor's degrees already? We have discontinued that, Hayley, so no, we don't. So you would come into our standard program, nursing program. So someone has asked, do you recommend the Bachelor of Nursing, Bachelor of Creative Intelligence and Innovation for someone who wants to work in paediatric nursing? I think so. I would just answer, you know, it's a great add-on to have a dual degree in terms of working in paediatrics. It's not something that would make you more specialised in it, but it may be something that you know, adds to your skills. So certainly, I would say that if that's something that you're interested in, that definitely you can do that. So I've got a question about vaccinations. So do we need to submit vaccination proof if needed? Rose, I might get you to answer that question if that's okay.
Yeah, so as soon as you accept your offer for the Bachelor of Nursing, you'll receive emails from the clinical practice unit, and that will advise you of what you need to do. And we need evidence of your vaccinations. And most of you, if you're school leavers, you'll be able to get your immunisation record off your MyGov. You will need to get a health card from the clinical practice unit, which is on level 6. And you'll need to get your doctor to fill that out. But yes, your vaccinations, the COVID-19 is very much present now. And as you would have seen in the news, that it's a mandatory requirement for healthcare workers. So I'd highly advise you to make sure you have that vaccine and you'll have that evidence. So you'll upload that into our system and you'll have all those logins as soon as you accept your offer.
Great, thank you, Rose. If I'm currently studying a nursing course as a Year 12 student at school, can I use that qualification somewhere as an advantage when applying for this course? So it's great that you're doing that. I'm assuming that's around an assistant in nursing program probably through one of the hospitals or through TAFE. It doesn't add to qualifications coming into the Bachelor of Nursing degree. In terms of being able to, it's around the UAC process. Are there any international opportunities? Natasha, yes, there are. They have been somewhat stymied because of COVID at the moment, but we do have in our third year a specialty course called Global Health, and that has the opportunity for global placements. That didn't run this year for those reasons, but those opportunities do come up we have had students previously travel to overseas as well as part of exchanges. So yes, there are some. I want to be a midwife and have been advised to look into studying for nursing first year, then applying for midwifery course. Is that a common scenario? Look, I'm just going to be biased and say you should become a nurse first, but you certainly, if you're at, and perhaps that's around the more limited numbers that midwifery take, certainly coming into nursing and having a nursing degree will set you up with a lot of skills, and then you can apply to do midwifery. So I know that other students do it. I have had students previously who have done it, yes. Can students enrol in this course if they are currently studying diploma in nursing at TAFE? Can we get credit for the units covered? So you can't get any credit because you're coming from, I guess the basic answer is the degree is higher than TAFE. So that means that a TAFE subject, you're not going to get recognition of prior learning for because it's not completed at the same level. So if you're currently studying it, you can still enrol in our course, but it would be the standard course. If you completed that diploma, then you would be able to come into our accelerated program, and that would bring the number of years of study down to 2. So which majors require a postgrad degree? I'm not exactly sure. I'm wondering if you're talking about the specialties that you are moving into. And you can move into those specialties without postgrad degrees, but you will often start to study postgrad. The one that was sitting there, nurse practitioner, is definitely a postgraduate program that you would be doing. So if I haven't answered that correctly, Melissa, please type another question for me. So Mark's going to answer this one. What classes and labs are based at UTS Moore Park? So Mark, did you want to answer that question?
Okay, so basically there's no nursing at Moore Park. It's all at the Ultimo campus. So all of your labs are at the Ultimo campus.
It is quite an amazing facility out at Moore Park, but that's for our sports science colleagues. My daughter's currently studying nursing overseas and would like to continue to study in UTS. Will any of her subjects be credited? So again, it's on an individual basis. I would need to have a look at the transcript. I would need to have a look at, there's a formal application process and we can provide you with those details. And it's called recognition of prior learning. Basically what we're looking for is that the course subject was completed within the last 5 years and that there is an 80% match to the content and the assessments of the UTS program. Also, anything that was done in the clinical space, if it's overseas, those wouldn't be credited here because those hours do need to be completed here. How many recent school leavers get accepted into the nursing course each year? So the estimates I think that we have for next year are around 600, 650 and around 200 in the EN space. Previously, we're not up at 1,000, but we have taken around 850, I think would be our high numbers. Is midwifery also a February admission date for EN TAFE April finish, or is there a mid-year intake? We don't have mid-year intakes, unfortunately. Will this degree be valid in developing world countries? So the process for finding that out is actually to it depends on the country. So yes, our degrees are recognised. It's a formalised degree, but because you're registered nurses, what you need to do is apply through the nursing boards in each country and to provide evidence, and then you become registered in those countries. And it's unique through, each country will have its own requirements. So for example, if you were going to Canada, you'd be required to sit an entrance exam as well. So I think that's answering the question there. Can Australian registered nurses work and practice overseas if you want to go to the UK and USA? So certainly you can, you just have to go through the registration process in those countries. If I wanted to do rural placements, will accommodation and transport be provided by UTS? We do provide some scholarships around that, but we don't, and please feel free to jump in, Rose, if you have anything to add, but we don't provide accommodation and transport is my understanding.
Yeah, you can also apply to New South Wales Government to get a financial support package when you're doing a rural and remote placement. So that's an opportunity for you as well.
Great. Rose, I might get you to answer this one because it's from a Rosie. I was wondering what the different options were for placement. For example, what hospitals were available for placement?
Yeah, we have agreements with all our local health hospitals throughout New South Wales. So any public hospital we have placements in. Also, we have placements with our private hospitals in Sydney and New South Wales. So we've got an array of opportunities and different facilities that you will be able to access in your degree.
Great, thank you. How many placement hours does the UTS RN course provide? So we have 840 hours. There are a minimum requirement with APRA, our registering body, is that you have 800 hours. So in our program, we have 840. Underage student doing a Foundations to Nursing and Health Science course with another university. Can I use this course to apply for UTS? Certainly through the UAC, you would include that information and you may be able to get recognition of prior learning as well for doing those subjects at another university. So make sure that you apply for those. Do you have mature age students in the full-time course? Any indication of the number of mature age students accepted every year? Look, we certainly have a range of students and we do have a number of mature age students. I wouldn't be able to give you a breakdown of those, though, but we do have plenty. In each class that I've taught, we have a mix. During a typical week of semester, how many days would students spend on campus in person, non-COVID times? So that's a good question. So the way that we have scheduled our timetable is that you will come in, it's in an intensive format. You do 2 subjects intensively for 5 weeks, then you pivot and do the next 2. So for example, in a Foundations of Nursing subject, you would do a 4-hour tutorial each week. And you would also then do something for science each week. So you might find that you can do that in 1 or 2 days. And then with the labs, you're doing typically either a 5 or a 7-hour day in those clinical subjects, and you're also doing another theory subject. So depending what your timetable looks like, you could, again, it would probably be 1 or 2 days as well. Once I'm an RN, can I work in a private hospital straight away? So our private hospitals also have new graduate programs that they recruit students to apply for. Typically, that's the route that you would go in through. Do students choose, I'll get you to answer this one, Rose, do students choose which wards they go on during placement?
No, they don't. The wards are primarily against your subject you're doing, and they're allocated accordingly to the subject that you're in, and each year has different areas that they'll go into. So you'll be allocated to that depending on the subject criteria.
Great, thank you. Judy, I might get you to answer this one. Judy's one of our clinical subject coordinators, and you'll meet her in first year. So the question, Judy, is if I do part-time study, will the clinical hours be halved?
Clinical hours as in placement hours?
Yes.
No. Is that right, Rose? You still be required to do your full-time?
Yeah.
Absolutely.
Okay.
Yeah. So
if you're doing a clinical subject and you're doing that in that session, you will have the clinical hours attached to that session. So you might take 5 years to do your degree, but when you do a clinical subject, you need to do those clinical hours with that subject in that session.
Right. So how many days? So I think I've answered the question around how many days per week. How is it spread out? Ideally in non-COVID times, what would be online? A lot of our lectures are online. We have drop-in sessions online, and then typically our tutorials and our labs and our simulations workshops are face-to-face. So that's how typically the subject will run. So what is recommended for a mature age student to do? So I'm not sure exactly, Lauren, what you're meaning there. Whether you're meaning part-time or full-time study. I guess it just depends on having a, enrolling, having a look at the timetable, seeing how you cope coming back to study, and then making that decision. And again, factoring in the amount of time that you'll need to do in clinical placements. Do students get an opportunity to study all nursing specialty areas before they choose an elective? So the answer to that would be no, because we're providing a generalised degree really in terms of our content, so that it means that you can become a new graduate work. The aim would be that you have the skills and you can work anywhere with that set of skills, and then you kind of develop up the skills. So some of you may have had a placement in a more specialised area before those third-year placements, but that's where you're going to kind of hone your skills. So Judy's going to answer this question because she is our perioperative specialist. So Judy, did you want to answer the question? I've just lost it. It was around becoming a surgeon.
Oh, okay. Yeah, that was further down. There's one up the top.
Yeah, to become a surgeon or something in that area, would this, of course, be a good way to get there?
No, they're very different degrees. However, if you are interested in the perioperative environment, you can become a perioperative nurse, which is my specialty, where you can be an anaesthetic nurse, you can do instrument circulating. So you're actually working with the surgeon, you're actually part of the perioperative team, so you're working right alongside the surgeon. There's also some advanced nursing roles in the perioperative environment. So there's a nurse surgeon's assistant, which is actually a nurse practitioner level role, and you are independent. You have your own ABN number, and so you're kind of like a consultant that works with the surgeons. And there's also opportunities for other advanced perioperative nursing roles, so nurse endoscopist, where you actually do procedures, nurse sedationist, so giving some sedation to patients as well. So there's lots of evolving and developing advanced nursing roles in the perioperative environment. So no, you're not a surgeon, because that's a medical degree, and that's 6 years of study and then another 10 years of work after that. But there's certainly lots of advanced nursing roles within the perioperative space as well, and that is offered in third year as a specialty subject.
Thanks, Judy. So I might get you to answer this one as well. Are there physicians' assistants in Australia? Is it a career that's possible for nurses here?
No, so physician assistants, no. So that's, I guess, the equivalent of what we would call a resident or a registrar. But as I said, within the perioperative space, there are what we call perioperative nurse surgeons assistants. So they might start the operation, so they'll do the incision, they help suture, they'll put in drains and things like that. But a physician's assistant, no, that's a medical role. That's not a nursing role.
I think they're in the US. I think physician's assistants, but we don't have those here. Okay, if you can't get into a graduate program job after graduating, what options are there for employment? So certainly there are different avenues to find employment. So, and there are lots of different graduate programs, so not just through, for example, New South Wales Health, which is our biggest employer. All of the private hospitals do that. Also, general practice facilities, the GPs will take on students who've nursing students who've just graduated. In the aged care sector, that is happening as well. You can also apply directly for RN1 roles, which the one just means it's your first year out. You may get agency work. You may become a vaccinator. So there are different opportunities, and that 6-week placement at the end of your degree is a real great opportunity to be able to network and just to build up contacts. You may be able to be able to make contacts that way. For example, my daughter is an emergency department nurse. She didn't get a new grad position. However, she was interviewed separately outside that program a bit later and did manage to get a position that way. Do nursing students generally learn in the same class groups? So do you have a regular group of peers you work with or who you do classes with? So yeah, that's what we're aiming to do. So we call that streams. So for example, when you're doing your clinical subject and the theory subject in that second part of each session, you're in the same stream because we want you to be in the same classes together, cohorts for those two, and you're going on placement at the same time as well. And also by having longer tutorials, so the 4 hours, kind of gives you the opportunity to better develop those relationships as well and be with the same people. If you're a part-time RN student, would your first placement be this? When is your first placement? Are they the same length? So if you're part-time and you're doing 2 subjects per session, then your first placement would be at the end of your second year of study, and your placements are the same length. So that would be a 3-week placement. And that's because you're doing the same subject at the time, and so all the requirements are the same there. Someone had asked a question about picking a major. So you don't actually have a major in our program. It's the same accredited program for everyone. So in terms of those third-year specialist subjects, you just pick them at the time. So you don't have to come in with a preconceived idea of what you want to do. And often people come in and think, oh, I really want to be a paediatric nurse, and then they decide midway through, actually, I think mental health's amazing. I'm gonna do that instead.
Yeah, I'd like to know more about the pathway to become a cosmetic nurse. Finished a diploma of beauty therapy. Would that help me on my application? A mum, part-time Bachelor of Nursing be available? Yes, you can work part-time, do your Bachelor of Nursing part-time. In terms of cosmetic nursing, cosmetic, or what they refer to as aesthetic nursing, is actually an unregulated area at the moment, but it is one that the Australian Nursing Midwifery Board, ANMAC, are actually looking at to become regulated. So there's no specific nursing course for aesthetic or cosmetic nursing. However, they are looking at where it will sit in terms of the specialty area, and at the moment they're looking that it will come under the umbrella of perioperative. So I guess if you are looking at to have some sort of qualification to complement your diploma of beauty therapy, perioperative will probably be the closest to that, because you are learning about all those specific roles around anesthetics, also about aseptic technique and handling instruments and all that kind of stuff. So short answer is no, there is no actual qualification for cosmetic nursing, but certainly perioperative qualifications will be what will get you leading towards that. There will be eventually, but as I said, ANMAC are looking at that now in terms of regulation. I hope that's
Judy. Thank you. What are the latest time slots you offer practical labs in a day? So Judy, do you want to answer that one because you work in the lab space?
So we have labs running all day, every day, so Monday to Friday, and we have our labs start at, well, these are first year labs, 8:30. They're 6-hour labs with a half an hour break. So the morning sessions start at 8:30 and the afternoon sessions start at 2:30. So you'll be finishing up around 8:30.
Yep. So I think our labs are open from 8 a.m. to 9 p.m. Typically we're not running till 9 p.m. because we don't really want to be there at 9 p.m. But we do offer them across the time. Any specific subjects that would need to be done in high school prior to applying for an RN? So I might leave marketing to answer around the specific subjects. What I might mention is that the things that you can do now to kind of get yourself prepared are to look at your vaccinations. what you need to have done, because that's something you can get started now, because vaccination is one of the key things that you need to have done to be able to attend placement. So not just talking then about that the COVID vaccination, which is something that we're recommending, well, we're likely moving towards making that mandatory, but all the other things like whooping cough, pertussis and the different ones. Also doing a senior first aid certificate, because that is something that that we ask you to have done in your first session of study. So, you know, once you're able to, if you can get those kind of things done, they're things you can tick off the list as well. So do students who completed the Diploma of Nursing go with students of first years? So no, if you're entering our accelerated EN program, you'll enter in the second year of the program. And you'll be with so when you're in classes, you'll be with other ENs in those classes. So we try to keep that cohort together. And that's something that Judy, who is our first and third year coordinator, kind of, you know, liaises with the different cohorts to make sure that they're settling in effectively. All right, so I think that we've answered all the questions and you've heard me talk for long enough. As we said, we will be making a copy of this available. If there are any questions that we haven't, that you think of, you know, you can get in touch with us, we can answer those. You know, best of luck for those of you doing the HSC. We just really all want to wish you the best of luck in these difficult circumstances. Can't imagine how difficult that must be for you all. And we really look forward to having you join us next year. We think nursing is an amazing profession. We think UTS is an amazing university to be able to, for you to be able to come to. So thank you so much. I'd like to thank the panel as well for giving their time up on a Saturday. So thanks to everybody for coming along today.